covering major news across San Diego. 10 minutes of non-stop news starts now.
We have much more ahead on 10 News Live at 5, including the growing fears of San Diegans watching an outbreak of the deadly swine flu unfold before their eyes. We'll have an expert on the subject in just a few minutes to explain what the real concerns are and how you can protect yourself and your family.
We are joined now by Dr. Larry Emdur. He is a pulmonary critical care physician with Alvarado Hospital.
Dr. Emdur is well versed on swine flu, and Doctor, the big question is, we hear about something like this, the rapid spread, now it's coming across the border, and people start talking epidemic. Is that a legitimate concern?
Well, I think everybody should be aware that swine flu has been around for quite a while. But it's extremely rare. Between 2005 and 2009, there's really been only 12 cases in the country. And usually it's people come in contact through the pigs, and the spread is usually self-limited. However, there have been, as you reported, about 8 cases here in Texas and California. The good news, no one has died, and it's been a self-limited disease.
What do you know about how effective our vaccines may be here that so many people get?
Well, the bad news is that the vaccine that we get gives no immunity for the swine flu. It's an H1N1 type virus, which is, there's an H1N1 antigen in the flu shot that you get every year, but it's slightly different. The swine is slightly different, so the vaccine will give no protection.
Now, we've known for years that the swine flu is usually limited to the swine population. What has caused it to move from the animal population to the human population?
Well, again, every year there's a couple cases, and it's usually when someone comes in contact with an ill animal. So that's been reported and can occur any time. When you mentioned pandemics, what's happening in nature is that all these viruses which circulate in this, both in the fowl population and the swine population can infect a human. The antigens can be repackaged, and you can get a slight change in the antigenic makeup of the virus. If there's a mild change, that usually doesn't cause a problem. If there's a major change in the antigen, that's what we're always afraid of as a pandemic, and I don't think that's been identified yet with this virus.
So if we do start to see it, do our antiviral medications help once you get it?
Absolutely. The good news is that there's a medication on the market now called Tamiflu, or oseltamivir, which is a medication that you take twice a day for 5 days if you come down with the flu, which will limit the disease. And prophylaxis, you can take it once a day to ameliorate the symptoms and prevent you from getting the disease. And this is also approved for children, and it's, I believe, in a liquid. So if you get sick, if you're on a high fever, contact your doctor. There's definitely a treatment for you.
Good advice.
In the meantime, we'll keep a cool head about this.
Keep a cool head. This is, again, very rare. Historically, it's never been a problem.
Dr. Larry Emdur, thank you for your time this
my
afternoon.
Pleasure.